Hello, and welcome to the 25th anniversary edition of the Finger Lakes Environmental Film Festival. We remind ourselves that we're running this festival as climate catastrophes multiply and intensify, when over 6 million people worldwide have died from COVID, and when the people of Ukraine are fighting a brutal Russian invasion and war. For all of us at FLEF, the world is our why. I'm Phil Wild, one of the producers of FLEF. Major sponsors of FLEF include the Park Foundation and Ithaca College, as well as the Park Center for Independent Media. Co-sponsor for tonight's event is the Department of Health Promotion and Physical Education at Ithaca College. Our festival theme this year is entanglements, a concept that explores how different environments, ideas, imaginaries, places, politics, practices, registers, and species twist into each other and enmesh. We are all very honored that you have joined us today for this vitally important and timely session, preparing for the next pandemic. We kindly ask you to rename yourself by adding your location. It's with great pleasure that I now introduce today's moderator, Stewart Auyash, Associate Professor of Public Health at Ithaca College.
Thank you, Phil Wild. I appreciate that introduction. And my name is Stewart Auyash again. I teach public health policy in the Department of Health Promotion and Physical Education. It gives me great pleasure today to have 3 alumni on our panel. And they are going to be talking about preparing for the next pandemic from each of their perspectives. I will tell you who the 3 of them are and then briefly introduce them as they speak. The order in which they speak will be Aron Thiim, who is a graduate of Public and Community Health from 2017. Shelley Facente, who is a graduate in Sociology from 2002. And Stacy Ann Ellis, actually Stacy will be second. Stacy Ann Ellis is a graduate of Ithaca College of both undergraduate and graduate, Public and Community Health at the undergraduate level and Community Health at the graduate level in 2018. And Aron Thiim, and Shelley Facente, Sociology in 2002. I think I got that right, finally. Thank you very much. So let me give the floor to Aron. You begin.
Hey everybody, hold on one second. I'm just going to share my screen now, pull up some slides. Okay. So my name is Aron. I use he, him pronoun series. I'm an IC grad of Public and Community Health back from 2017. I'm born, raised, and live in Boston, Massachusetts. I've been working for 6 years now at the intersection of harm reduction, infectious diseases, and sexual health. And I'm not just an employee in public health. I also am a person who has other activities and interests. So I like outdoor sports. I like to cook food, particularly Latino food. And I like visiting dog parks with my Boston Terrier. I'm currently working at the Justice Resource Institute, developing and managing clinical programs in sexual and drug user health. So what has the pandemic taught me? I wanted to pull out 3 sticking points or sort of themes that have consolidated some of my points that I'm going to talk about today. I know these are really large and nuanced topics that requires, I think, a lot more time and effort for proper discussion, but I really do think that this is going to segue into some meaningful deliberation. So just starting out with brutality of inequity, marginalized people are disproportionately affected by viral infections, from HIV to COVID. I think the impacts of COVID and our response to disease really clearly illustrates the failings of science and policy, especially in the context of race, ethnicity, and income. Socioeconomic vulnerabilities increase COVID risk due to the disproportionate risk of being underinsured, lacking access to care, and experiencing poor health outcomes from preventable and treatable conditions. And COVID has definitely shined a very bright light on these pervasive inequities, particularly for people of color who already experience higher incidence of chronic diseases like hypertension and type 2 diabetes. So we as a global society really are a chain as strong as its weakest link, as cliche as that may be. Next thing I wanted to talk about was misinformation about science. I have a quote here said by the godfather of vaccination, Louis Pasteur: "Science knows no country because knowledge belongs to humanity and is the torch which illuminates the world." And I think this was really powerful for me because if science is the torch, then I believe that much of the world has been left in the dark. It's likely that you too have been duped by misinformation over the past 2 years at one point or another. I think misinformation is ubiquitous. An initial distrust of COVID vaccination, I think especially in communities of color, was understandable based on the history, crippled by unethical scientific practices, as we know. But the ease of sharing content globally at the push of a button really fuels this issue further. And public health is political, but politicizing science is harmful. So in public health, politics is often viewed as like the subway's third rail. You shouldn't touch it or you get electrocuted, but it does provide essential power to the train. So meeting our key public health goals really requires this strong relationship together between our public health systems and our political systems alike, but it can be a really contentious intersection for sure. Given that public health decision-making is driven by science, though politicians have to consider a lot of other variables that often go beyond the science itself, and typically valuing other factors over scientific considerations. And then the last point that I just wanted to address was public health workforce issues and funding. So there's been a historical underinvestment in public health infrastructure. Sadly, over the last decade alone, the annual budget for the CDC, which is our nation's primary federal provider of public health funding, has fallen 2% when adjusted for inflation. Meanwhile, since March of 2020, so 2 years ago, Congress has passed a series of measures that have provided more than $55 billion in COVID response funding for various agencies. So this just really demonstrates the need for sustainable long-term funding to maintain and improve public health rather than just this boom and bust congressional provisions. As far as public health workforce is concerned, I think we're currently amidst sort of a great renegotiation, a term I heard recently on NPR, across our economy in all sectors. A renegotiation not just of pay and benefits, but also of our relationship to work itself. And I think that we're going to have to dignify these direct service roles in novel ways in order to really strengthen a pipeline of diverse public health professionals who are going to be spearheading the efforts to prevent our next pandemic. Just quickly summarizing, so takeaways here need intentional focus on equity, integration, science is real, and public health is underinvested. Workers are essential but undervalued. And that is all from my slides.
Thank you so much, Aron.
Sure, pleasure.
Our next speaker is Stacy Ann Ellis, a 2016 and 2018 graduate of Ithaca College. She is currently the Assistant Director of Quality at Cayuga Centers in Ithaca, New York. She's Zooming to us this evening from New York City. Stacy Ann?
Hello, good evening. Thank you so much for having me. It is an absolute pleasure to be here, to be speaking in this capacity. Yes, as Professor Auyash just mentioned, I am a class graduate for 2016 and 2018 because I love Ithaca that much. It has been an awesome experience, and I'm happy to be here. So, what are my takeaways from the pandemic? My first issue is the education piece. You know, people outside of the healthcare field don't necessarily have the level of education or awareness as, you know, well, not people in the public health, people outside of those healthcare measures don't have that level of education and knowledge of how, you know, the level of risk measures there is for a pandemic or epidemic, or, you know, infections and diseases in that capacity. So the education piece was not fulfilled, not because it was intentional, just because, but it was because more so there wasn't a need to fill the education level. So for me, that education piece was missing. And then that follows by the level of understanding. During the very initial phases of pandemic, there was a lot of information that was being fed to individuals, you know, and in, you know, as Aron was mentioning earlier, you know, you can't politicize public health measures. You can't do that, because at that point you have many individuals who are hearing conflicting ways of how to do things. For example, conflicting measures on how you're supposed to wear a mask. You have government officials giving certain directives, and then you have health officials going and giving other directives, and then they're conflicting with each other, which impacts how public responds to public health measures. My third point here is overall, the US public health measures are in fact lacking. My point in saying this is the way how we approached wearing masks or wearing gloves, or how we cleaned areas. All of this, while it wasn't new in a healthcare sector, on a larger scale in terms of businesses and how we cleaned, it really highlighted that our measures towards having a safer environment was actually lacking. And the pandemic brought out that in terms of like a microscope to make it larger, how we respond to each other when we're sick, in terms of how we, you know, interact with each other, how we, you know, wear a mask, whether we're on public transportations, you know, going to parties, going to each other's houses, and essentially forgetting about the fact that we're still in a pandemic. So overall, I would say a large mass of education, and how we responded to that was, you know, how it was my essential takeaway from this pandemic, and how we can do better for the future years in making sure that we're educating people from the ground up.
Thank you very much, Stacey-Ann. Our next speaker is Shelley Facente, 2002 graduate in sociology. She is the founder and executive director of Facente Consulting in Berkeley, California. Shelley?
Great, thanks so much. I'm going to share a few slides. And, you know, my colleagues did such a great job talking about preparing for the next pandemic and the experience of the pandemic from the perspective of someone working in public health, which of course I am as well. But I'm going to actually look a little bit at what I think is all of our shared experience of what Aron termed the great renegotiation, which I hadn't heard before. But I think for us at Facente Consulting, we went through a great renegotiation and learned a lot. And so that's what I'm really focusing on in my talk. So I just have a few quick, I'll give you the story and then my 3 points. So just to give you a little background, Facente Consulting is a health equity focused public health consulting firm. And our tagline is understand, implement, tell your story. That's the umbrella of work that we do with our clients. We focus a lot on evaluation, needs assessment, strategic planning, facilitation. a lot of things that involve a lot of in-person work, really hands-on with a lot of people. And we've been headquartered in the San Francisco Bay Area, which is where I live, but we've never had a physical office. We've done a lot of work in place, in physical places, but we've all worked out of our home from the beginning. But before COVID, there were 5 of us, and we worked from our homes, but we all lived in the Bay Area, and we had an opportunity to do things together a lot. It was like having an office. We were able to do in-person retreats and bond over conversations about family and all sorts of things that maybe aren't natural in a virtual office, but we had that physical space together, even if we didn't have a water cooler that we shared. We also did a whole lot of work that involved travel, involved in-person work. This is a training that I did in Uganda in 2019, August of 2019, just months before we really realized what was going on with the pandemic. And it involved things like official meetings and official presentations like you see in the top right picture. It involved, like you see in the bottom right picture, really seeing a place, really feeling what it's like and getting a sense of where you're offering the training, what people's experience is in a way that you just can't over Zoom. It involved a lot of hands-on training and skills practice, like you see in the bottom left picture, but also a lot of social time going out together to eat and learn and share with each other, which is also something really difficult in a virtual environment. So then all of that really changed. And with COVID, like with all of you, a lot of things happened. One is we worked in public health, so there was a lot of demand for our work, and we ended up exploding in size. We went from 5 to 10, and we're soon to be 12 people all over the place. And in fact, all of these people don't live in the Bay Area anymore. When we first started recruiting new consultants because of our growth, we realized, well, we're doing things 100% virtually right now. We certainly don't need to be making everybody live in the Bay Area. Let's think broad, let's cast a wide net. And our original idea was that when COVID was over, we would ask people to relocate to the Bay Area. But eventually, as this whole thing dragged on, we realized this is working. We can do this and have people in all different time zones all over the place, just like how FLEF is working just fine in a virtual environment. It's not the same, but it works. And that's really what we've found. So now we have all of our meetings, we have parties, we plan all of these social things. They're on Zoom. We just have to be more creative. We are doing an in-person retreat and a lot of us will meet for the very first time after 2 years of working together this June with any luck. But we've also had to really learn to be creative. We've learned a whole bunch of new tools. This is a presentation from a conference that was in Armenia that I would have gone to Armenia and presented. This is my name right here, which I learned is my name in Cyrillic, which I didn't even know. There were all sorts of things beyond just Zoom. There was simultaneous language translation happening where depending on the language people were speaking, they could hear what was being presented. There were all sorts of tools that we've learned that work in the virtual space that make the experience a positive one. And as COVID restrictions have started to ease, we've also had to be creative about how we can return to some in-person work while making sure that people stay comfortable and we keep people as safe as possible. So in the bottom line, there are 3 key takeaways to what we've really learned in preparing for the next pandemic. The first is we have to be adaptable. We have to expect change. We can't just hope that we're on one track and finally now we can take masks off so we never have to worry about it again. We have to sort of lean into the good moments and then be prepared that it might change again, and we have to roll with it. So we've learned to be really adaptable. The second is to be prepared. And by that, I really mean doing everything we can to learn, try new things, and really lead, not just follow, wait for someone to tell me what the rules are, but really engage and say, what makes me feel comfortable based on the information I know? What do I have to know? What conversations do I have to chart the path based on what we know now? Because we won't always know the answer. And the third is to be creative as much as possible, to be proactive, not reactive. Not being frustrated that well, I want to do it the old way, but I can't, so I guess I'll just suffer through it. But approaching it saying, okay, what can we do? It's going to be virtual. How can we make it the best experience possible? What tools are available? What can I learn? What can I develop that will really make this a great experience? And so for us, that's what we really found worked. And hopefully that's useful advice for any of you, whether you work in public health or not.
Thank you very much, Shelley. As moderator, I'm going to take the privilege of asking the first question of our guests, and before you open it up to the general audience. Let me start with Stacey-Ann, but I'm going to ask you all the same question. If your boss, or in Shelley's case, herself, because she's her own boss, where would you start with some of the things that you would now want to be prepared for? How would you begin to think about, we have to make sure we do this? Can you give us some kind of examples of what you would be doing? Stacey-Ann, would you go first, please?
Sure. So my first point in how we can move forward would be, first and foremost, to be honest, right? I think there is a lot of information floating around, and there's a lot of distrust in communities. Aron spoke on that earlier, you know, especially with the Black and Brown communities. You know, the African-American community is still in that kind of distrust phase, right? And so in order for us to come back from that kind of experience, I think first and foremost, or public health needs to be honest in what they're doing, because we need to reshape the kind of image that is out there at the moment. And so in order for that to happen, because people, they have resources, you know, we can find the information, but if the people in the government leadership roles and also public sectors are not coming out with complete honesty, people can sense that and people react accordingly, right? We're advancing in so many different ways. And so at this point, we need to have a level of transparency, right? It's a give and take relationship. If you want to, you know, vaccinate, then be honest. What exactly are we getting into here? You know, what are the side effects? What do you know? What don't you know? Right? So that way no one goes into it blindly. So that's my first point in how we can essentially move forward. The other part is to have a person first response. There is no one size fitted all kind of measure in this scenario. You know, everyone have a different experience. The Hispanic community, the Black community, you know, the white American community, we all have different experiences, or cultures are completely different. And so to have a one size fits all kind of approach, people will essentially, you know, back away. It's like a polar response, you know, that doesn't create more people to do what needs to be done. It creates more friction. And also my third point is to somehow create a level of respect within different levels within our community. By that, I mean, in terms of government sector and public health workers, right? We need to have the kind of communication efforts where we're supportive of each other, right? And we don't have a different kind of agenda, right? We share the same thoughts. If you're working with the CDC, or you are, you know, the president or whoever else, communicate on an individual level and create a plan where, you know, we have one thought coming across, instead of the government saying one thing and the CD saying another, and now everyone is angry and conflicted with each other. So I would say those 3 points would be major in terms of how we move forward.
Thank you very much, Stacey-Ann. I'm going to go to Shelley next, and I'm going to add something to this question, which is also, I think, we can all agree that public health has experienced sort of a credibility problem. We've had public health directors resigning en masse, and not because they're not doing a good job, but because they're being treated very poorly by people in their community. If any of you want to address that too, please. But go ahead, Shelley. What would you say to that or other question that I guessed previously?
Well, I would say two things. One is it's been a really hard time to work in public health. I think so I have my PhD in epidemiology, even though I got my original degree was in sociology. And so when the pandemic happened, I was thinking, not that I was excited, but my colleagues and I were thinking like, this is what we've trained for. We know information. We've got this. Just listen to us. We know what to do. And then pretty rapidly, it was very clear people were not really listening or didn't want to listen when the information was something they didn't really want to hear. And it became very quickly conflated with economics and politics and all sorts of other things, which are also important to the picture. And so it turned into this sense of we aren't communicating well in public health. I don't know what I should do. And meanwhile, I think public health people were saying, I keep saying every day what we should do. What are you talking about? And so if there's a good lesson learned, I would say it's that we need to actually build these relationships and infrastructure up front. Now we need to do it now as things are feeling better, not wait for a crisis and then look around and say, wait, aren't you supposed to be listening to me, or aren't I supposed to be listening to you? But really have systems for doing this, learn from this so that we're prepared next time. And I do think there is something to be said about communication. And this goes to what Stacey-Ann was saying around trust. I think I've had many years of public health schooling, and how to communicate to the general public or the media is not something that has been front and center in any of my public health education. And I really think we need to start considering in the field of public health that the ability to communicate to someone not in public health is a key part to being effective at your job.
Thank you very much, Shelley. Aron, I put the question to you.
Yeah, I would echo all those points. And to Shelley's point, language accessibility is critical. I think, though, I would like to tackle the workforce issue. I know I talked about that a couple of minutes ago, but I mean, just from being boots on the ground the past 2 years, I've been in person the entire time. I haven't worked remotely at all. And I have witnessed employees, coworkers, friends of mine just leaving in droves because they just haven't been supported adequately. Support, can come from a bunch of different directions and mean different things to different people. But even something as basic as like the relationship with work and how people are getting paid and being acknowledged for the tireless efforts that they've put in, I think is something that people are waking up to a little bit more. So I want to make sure that there's a secure and stable workforce who are committed to not only the mission and the work that we're doing, but that there is going to be a sustainable workforce in the future as well. Because I mean, if we were only 2 years into this pandemic and people are burnt out, what's going to happen with the next one, right? So just ensuring that the rights and the performance condition, the employee conditions of the workforce are high level.
That's a really good point, Aron. And let me go back to that topic too, because it seems that not only did we maybe need to be prepared with our skills, but what about our understanding of the audience and also the mental state that we have to deal with ourselves in terms of the stress that we might have to undergo during the next pandemic. So let me start with Shelley this time. If you can address, what would you do with your employees to prepare them for the next pandemic?
Oh, that's a good question. I think two things come to mind. One is, I think that we all learned during this pandemic that we're all very different people in the way we relate to others. Some people were much more introverted, didn't have much problem being more isolated and doing things remotely, and other people that felt like torture. We all relate to each other in different ways and we need different things. And I think not just being aware of that for ourselves, but being encouraged to think about and communicate that to our coworkers, to others, so that they understand what we need to thrive when we're going through a very stressful time is something that's really critical. And the other piece I would say is technology. I think that when the pandemic first started, I heard a lot of people say like, okay, I'll put up with Zoom or I'll put up with this remote option because we have to right now for safety, but I cannot wait for it to be over. And I think what we actually learned over time is that there are a lot of benefits besides just protection from an infectious disease, from having more flexible options, from having more virtual ways for people to interact. It means people don't have to worry about as much travel time or those. I live in San Francisco where it's very hard to afford to live right near where you work if you work in San Francisco. And so people who have less money end up living far away. And if for them, it's a big relief to not have to have an hour commute and worry about childcare and deal with public transportation. So just helping people get comfortable with remote options and other technological alternatives so that we have those options all the time and not just when we're most under duress is, I think, a really important way to help everybody get prepared.
Thank you, Shelley. Aron, what do you think your organization should be doing?
Organization or I want to start with people. I think that people most first and foremost should just stay true to themselves and their non-negotiables, not sort of giving in to the pressures and influences around us. As an organization, I think that we're having internal conversations about what this looks like to support our employees. I would like to really stress that normalizing behavioral health and mental health care. I am someone that actually started therapy during the pandemic. I know that there's increase in utilization of behavioral health services as well. So if we can fund and invest programs to support our employee wellness initiatives and programs, I believe that to be really paramount.
Okay, thanks. And Stacey-Ann?
So during the pandemic, I would say my my job was very forward in making changes. Well, not at first, just like everyone else. We're like, we'll go back to work soon, right? And then after a while, you're like, yeah, that's not going to happen so quickly, are we? So I think one of the things that we would learn or need to learn how to do, as Shelley mentioned earlier, is to be creative in how we go forward. Because without the creativity and innovations of, how do we do this thing, it's not going to work. Because, if we had stayed into this boxed idea of how, everyone needs to go to work, figure out how you're going to take care of your kids, everyone went through so much and we had to become creative, right? So for example, one of the things that I believe it is paramount to how we may succeed, in an expanded, and hopefully Aron, it's not in real life still, right? So we can put the work in there now. And I think the important thing is making mothers, not to say men are not important, because you all are, right? But the brunt of the issues fell on mothers, right? And so we have to put that to the forefront, because we all know that the workforce is not set up to accommodate women and mothers, right? Because when you have children, what do you do when the school calls and say your child has to come home, right? Who's gonna go? Is it the mother or the father, right? When your child is sick, who's gonna stay home? Is it the mother or the father? 9 times out of 10 is gonna be the mother. So I think the way in which we can accommodate and move forward in the future is to understand the level of importance that a mother brings, right? Because, for example, if my job didn't take that into account, we lost a lot of people because of that, but they had to adapt after to say, okay, this we need to put to the forefront. If they didn't put the fact that mothers need time home with their children if they're not going to be in school? Because if school is shut down and now everything is virtual, who's staying home with the 5-year-old, right? So those things have to be important issues we need to address, the importance of mothers, not only in the physical office, because honestly speaking, they probably work twice as hard when they're home. Because if I work twice as hard as at home and I have no children, I can't imagine what a mother does when she's home with her children, right? So understanding those, important pieces of women in the workplace and how we have to adapt, more than is being acknowledged, I think that would be a very important way how we move forward in terms of our adaptability efforts, and our creativity. We can do it, and we did it, right? We did it. So
far, so good. I don't know. We'll have to look back at a different time too. I want to remind all of our audience that feel free to raise your digital hand, and we'll begin to go to the audience questions now. I see Patricia Zimmerman has her hand up, but please, the rest of you, I encourage you to come up with any questions, and I'll be happy to call on. Dr. Zimmerman?
Yes, thank you. I'm in a state of great humility and awe. There's nothing better than being a professor at Ithaca College and seeing 3 brilliant alums totally open my mind to new ways of thinking. So I want to thank you all. When the pandemic started, I asked Stewart, who I happen to live with, well, when will this be over? And in week 2, he said, minimum 2 years. And I was crushed. And then when things started changing, I said, what do you think? And he said, this is going to be with us forever in one way or another. So my question is a really simple one. The topic, preparing for the next pandemic, is assuming that we will never be in a pandemic-free life, maybe ever again. So I'd like to know what you 3 are thinking about how do we think about living in a state of perpetual pandemic and perpetual preparedness. Because I think there's a lot of discourse out there, particularly in popular culture, and on campuses sometimes of it's finally over. But given who I live with, the term over is not operative. So if you could just illuminate us in terms of how public health professionals are thinking and give us some ideas as we think about the next pandemic or maybe the continual state of perpetual pandemicdom, I'd really appreciate that.
Well, I could start by saying one thing that I hear a lot and from my public health colleagues and I think about with my own family is really the triad of vaccination, ventilation, and mask wearing. And I know no one wants to talk about masks. Masks seem like such a awful thing. And yet to me, for myself, they're a ticket to me feeling like I can re-engage in the world in a way that I still feel safe. So I feel like I can go to a concert with my family. We're just going to wear our masks, our quality masks. I feel like I can, go out and do a lot of things, facilitate those meetings like that picture I showed, and travel and do all the things I used to do before. I don't have to give those up. For me, being vaccinated, paying attention to ventilation, meaning being outside when I can, trying to have windows open, those little things for me make it feel like I can resume my life and still stay safe. And I think everybody has to sort of decide for themselves how they find that balance of the amount of risk they're willing to have. And we need to let other people make that decision for themselves and not judge, well, you're wearing a mask or you're not wearing a mask, and that means this or that means that. We all just have to sort of make our own decisions and be prepared to be flexible, because when the numbers are looking really good, enjoy it, do everything you can. And when the numbers inevitably don't look very good, well, put that mask back on. We can keep going. We don't have to go back to March 2020 where we felt like we shouldn't leave our houses.
Thank you, Shelley. I just wanted to remind the audience again, I know I have some students out there who have questions. Don't wait till class tomorrow. You can ask them now. Stacey-Ann or Aron, would you like to also answer Dr. Zimmerman's question?
Sure.
Try to keep your responses to about a minute too, by the way.
I agree with Shelley. And for me personally, I like wearing my mask, right? To give me a personal sense of security, and it's a way of adaptability, because now you have to communicate with my eyes. What are my eyes saying, right? So, that extra, factor of, protection, and how, I navigate the world in a way where I don't necessarily fear going outside. I live in New York City, right? And when the world was turned upside down, I had to face that reality. And so even though the numbers are looking good up outside, I still wear my mask because that gives me a sense of security. On the other hand, I don't have like this grim feel of thinking that we will forever be in this cycle. Like Professor Auyash, I gave it 2 years, right? In my workplace, they're like, oh, everything will be okay in 3 months. I'm like, we'll give it 2 years, right? Because there is this level of understanding what you were taught, right? And also how people are behaving on an individual level versus what's the projection here? What are we doing with ourselves? And I tell my CQO, see, I told you everything will be better by this time, So I have a little bit more positive hope of how we're going to proceed in the future, because in the end, we are not going through our past pandemics. We're going through the current one, right? So, vaccination will come and go, but I think we're adapting well, I would say.
Thank you. Thank you, Stacey-Ann. Aron, did you have a chance at this one?
Yeah, I think people overall are just extremely resilient and adaptable, and I know that we're going to come together to tackle whatever is next, if there is a next, or when that may be. I am looking at this from a harm reduction philosophy. Viral infections are not going to go away. There is definitely going to be a next one, but I think that we have so many different tools in the public health toolbox to take advantage of, like Shelley was saying, masks, vaccinations, et cetera. To really reduce the harms of these viral infections so that we can take calculated risks and live as close to normal as possible, even though there isn't ever going to be a normal. This is the new life that we live.
Thank you. I see a number of hands up there now. I'm going to take my advantage of calling on one of my students. Abby Hall, would you like to ask your question? Would you like to ask it to someone in particular or just generally?
This is just a general question, I guess, sort of an opinion. How do you feel that schools have handled the pandemic, and how can they be better prepared? Or, yeah, I guess that's about it, especially like colleges, because they're sort of like a small community.
Okay. How could colleges better prepare? Okay. Which one of you like to take that on?
I can give my opinion, right? I can give my opinion. I would say, and this may not be a very popular response, I would say that all academic institutions, whether it goes from, pre-K to college, they did the best they can with what they had, right? So we can go and we can say, you should have done this better, you should have done this better, you should have done this better. But really, a lot of us, just like anybody else, we were hit like a deer in a headlight, right? We're there and we're like, what do we do with this, right? So in the moment, the options that were given, I think that they did the very best that they can. There is life lost no matter where we take it, but we did the very best we could, in my opinion.
Thank you. Shelley?
Yeah, I think I might add, one of the things that I saw, and actually I'm more in the world of thinking about elementary school, middle school, even high school, and not as much college these days. But regardless of what school you're talking about, I think that in school, like in many businesses and other places, what I often saw was a reliance on what the health department was saying. So if the restrictions got stronger, well, then we'll follow the rules. But if the restrictions lightened, even when what the health department was saying was now it's optional, now you don't have to do this, but we strongly encourage it. What you saw ripple through all kinds of schools, businesses, and everywhere else was, okay, well, now we can't require it, so it's not a thing anymore. And I think that in preparing for the future, we really need to be willing as institutions to consider what's best for our institution, the people the students, the faculty, the staff, the community around, to use the school example, to be unafraid to lead and be fearless at what seems like the right choice, regardless of what the health department rule says. Because a lot of times health departments are affected by politics. They're not in total control of the policies. And so even if the scientists in the health department think the rule should be a certain way, that doesn't mean what the restriction will look like. And so we need to free ourselves from this idea of, well, I'll just do what the health department says. That's my suggestion.
Thank you, Shelley. You want to weigh in, Aron, or should I have another question?
Sure, just quickly, I just wanted to say, I think there are huge disparities in the ways in which different districts and schools can actually tackle issues like COVID. Just if you think about the ways in which different districts have disparities in some more amounts of money and infrastructure to provide, say, remote formats to teach students who are at home versus some school districts that don't. And then it also falls on the teachers to be the public health professionals to enforce these policies as well. And a lot of them aren't equipped to do so, especially when you are thinking about a bunch of 6-year-olds running around a classroom and you're trying to tell them to put a mask on. So it's really, really challenging.
Thank you. Phil Wild, you've had your hand up for a while. What's your question?
I just want to really thank everybody for bringing up the subject of masks. I really feel like there's a stigma involved with it that we really have to confront. I was in a convenience store. I wear a mask indoors. I'm slightly vulnerable, and I haven't gotten, anything in 3 years, and that's wonderful. So I'm a mask wearer, but I've been confronted, and people have stood right in front of me and went, "What's wrong with you?" It's really, there's a stigma that we have to address both socially and personally about wearing masks, and it's not going to be easy for everybody. And I'm kind of making more of a point than a question, but I'm wondering if I want to make sure that we're all thinking about that stigma every once in a while.
Thank you, Phil. Marcus Bancola.
Yes. Hi, I just wanted to ask if you can give an example where science is politicized, just to give a better understanding on that statement.
I think I mentioned this a little bit. I think one example directly is just when we turn on the news or we listen to media and we see politicians who are faces of communities who are speaking out on issues to their constituents, confronting science. They are not scientists. They often will share information that is not always correct or that just advances their own political agenda. So to my point there being that politicians are not scientists, they should be following the science and listen to folks who are actually doing the research, doing the work on the ground. Whereas it's been quite the opposite, just leveraging for their own agendas.
Thank you. Rachel Geary.
Hi, I just wanted to ask this question with the advantage that all three of you are Ithaca alum. I was just curious if your time at Ithaca, if there's any influence that you can think back on being a student into the work that you do today and with the COVID pandemic now being a big part of the work.
I can tackle that. So I matriculated at IC in 2013 as a biochemistry student. I was quickly not enamored whatsoever. I actually discovered public health. I took a class at a home institution and quickly started realizing that like socially contextualizing science was way up more on my alley. And I got in touch with Stewart. The first public health class that I ever took at IC was with him. And I would say that the coursework and the professors and the investment that they have in that program is what really, I think for me, set off a career in what I'm doing now, and really my investment in public health. I think that IC definitely prepares folks for what's to come in the future. And it was like one of the main reasons why I'm still here today, just through the faculty and the amazing program that IC provided me.
Thanks, Aron. Thanks for that shout out. Appreciate it.
Sure.
I remember you sitting in the front row of class. Shelley, Stacey-Ann?
Yeah, I would say, shout out to you again, Professor. I think that I was sitting here trying to remember what was the name of the class, but I think it was epidemiology front page newspaper or something like that.
Front page public health.
That one. So I absolutely believe that that class, it kind of navigates who I am today and how I view public health. So I would say that experience and grounding me in my understanding of public health on a different level, in terms of, yes, I had like other epidemiology classes and public health classes, but that one for some reason sticks out in my memory, and how I actually effectively behave and navigate, and how I advise, or, in my position, and how people navigate, the workplace or in everyday life. That class was part of, what makes me who I am.
Okay.
And speaking out too. Yeah.
We're running short on time, but Shelley, do you want to add something to that?
I don't have too much to add. I came to public health in a roundabout way, and Stewart also played an important role in that. I started in music school, and then found my way to sociology and didn't even know public health really existed, but eventually met people who helped me understand that the intersection of all the things I was interested in was what public health was about. And that absolutely was my incentive to go to get my Master of Public Health and launch my career.
And you were brave enough to be the only person to visit our family in Singapore during the first SARS epidemic.
That's
pandemic.
Right. I've specialized in pandemics from the beginning. Who knew?
Let me go to Irene, one of my students. If you have a quick question, please, Irene.
Yes, sorry. Going back to the discussion about the politics and the politicians who are not necessarily scientists saying things that may or may not be true. Would you say there would be an advantage to more scientists taking a more active role in politics, and that way there could be like more of these are like known factual people that are backed with education and research, and just finding a way to shift like public health and health in general into the political eye, so that like it's more heavily represented than it is now?
Aron, you want to take that on?
It's a really good question. Or did anyone else want to add?
Make it short. Make it short.
No? Oh, okay. It's a really good question. I think that like foundationally, if you think about both disciplines, public health and politics, they have different motivations. Again, like decision-making for public health practitioners, myself, driven by science, follow data, deeply committed to science and scientific method. Whereas with politicians, their agendas we're not always certain of, and they waffle a lot. I think it could definitely behoove folks in politics to definitely be more attuned to science. I don't know if we need to have scientists per se become politicians. That's unique. I mean, we've seen scientists, physicians go out and run for public office, which I think is really unique. It definitely would behoove, I think, politicians to be more attuned to the science. I can't say whether or not they should go into that discipline.
Great, thank you. We have time for one really quick question. Grace, if you can make it quick and the response quick too, just like one sentence.
Hi, I guess my question, kind of pertaining to the title of the talk, is preparing for like the next pandemic. In all of your opinions, are we prepared for the next pandemic, or will we be able to use what we've learned from the past couple of years in the future, or do you think we'll kind of like forget about it?
I would like to say, I think we have everything we need to be prepared for the next pandemic. Whether people are willing to think about the lessons learned and actually invest in changes that will prepare us at the top levels is another question.
Okay. Yeah, I would completely agree there. I think we have all the tools needed to be able to handle another pandemic. But I think what we overall need to work on is a level of communication. You know, we so easily say communicate, 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 right? But that is such a difficult task to do when you're communicating through different channels and different levels. So I think that, you know, everyone communicating with each other, creating that kind of connection to say this and this all create a level of intersectionality, right? And this is how we move forward when we think together instead of as individuals and I want to win versus this person. Once we all come together and understand that we have the same goal, I think we'll be able to handle anything that comes at us.
Thank you. Thank you all very much. And thank you everyone for your questions. Now we just have a couple minutes and I want to ask each of our panelists to please give about a 1 or 2 sentence takeaway from your comments today and your listening to other people's comments. Let's go in reverse order. So Shelley, could you go first, please?
Sure. I would say, I think the big takeaway for me is to be adaptable and be fearless. We can't be thinking about, oh, well, now I'm stuck doing this or I'm forced to do that. I think the way we get through this and whatever comes in the future is to seize the opportunity to figure out, be creative, figure out how to make it work and learn lessons.
Thank you. Stacey-Ann?
For me, my takeaway from this discussion is that we all have the same goal at the end of the day, and how we can, you know, move forward is essentially for us to be adaptable and creative in how we are approaching the future. Because without a little bit of a creativity, we will be boxed in with what was old and not what is new.
Thank you. Aron?
Get comfortable with being uncomfortable and live with an open mind. I think as we hear information that is new to us, be open to it, process it, think about it before possibly injecting your preconceived notions about the topic. Learn a little bit more about it.
Thank you very much. And before we hand it over to our producer, I just want to say thanks to all of our panelists and all the participants who were here today. I know I learned a lot, and I'm going to conclude by first of all saying that we all know all of the challenges that the clinicians, the doctors, the workers who were cooking the meals, the taxi drivers, and especially the nurses who really had a tough time throughout this pandemic and are still dealing with a lot of shortages and issues. Don't forget, you have to also hug your public health workers too. They're behind the scenes. You often don't know who we are, but they're also just as important over the long run as everybody else, because as Stacey-Ann and others have said, we all kind of are on the same side here. So thank you all very much. I'll leave it over to Annie Michelle.
Wow, what a great session. Thank you all so much. Hey, I invite everybody now to go on gallery view so that we can give a round of, and take your mics off mute, and we can give our speakers a round of applause. It's really wonderful for them to see this wonderful crowd. Such a great session. Everybody, a big round of applause. Thank you. And 2 things, I've got a party favor for everybody in the chat. It's a PDF file that has all the different links and interesting comments encapsulated. So go to the chat, grab that, and then stay for our little after party. I'm just going to very quickly roll our credits and then stick around and we can have a more informal, unrecorded discussion together for about another 15 minutes. All right, I'll see you in a few.